Hello, my name is Lizethmunoz, and I am a nursing student at Aspen University. Today I will be going over a scenario and answering a couple of questions in regards to it. So the scenario displays a 54-year-old female patient who was brought into the ER. The EMS personnel who brought her in stated that she was found wandering in a nearby park and she had fallen, which caused her to seriously scrape her arm and her face. The woman is bleeding, she is disoriented, combative, and she began to accuse the EMS team of stealing her purse. Her hands are shaking severely, and she is shouting at the doctors and nurses that she needs her bottle. The woman's clothing is dirty, and you could smell stale body odor and urine coming from her. Question number 1. Based on your impressions of this patient's actions and appearance, what do you suspect she is suffering from? At first impression, it is clear that she is suffering from a mental illness. Given that she was found wandering around with dirty clothing and is protruding the smell of urine and stale body odor, it can be assumed that she is suffering from senile dementia or Alzheimer's disease. Her actions of combativeness, disorientation, and false accusations, as she stated that the purse had been stolen by the healthcare professionals, are all signs of an episode of dementia. Number 2, what short-term and long-term health risks would you suspect this patient faces? For short-term risks, I would suspect that she will have changes in personality. She can become distant from her loved ones. She will continue having confusion, and she may develop the inability to perform daily tasks such as eating or using the bathroom. For long-term health risks, I do assume she would have the inability to walk without any assistance. She will also have the inability to sit up straight without any assistance, and she may begin to have bowel and urinary incontinence. She may also lose the ability to speak and communicate, and at the time of loss of cognitive function, this can lead to a vegetative state and ultimately death. Number 3, why do I think the patient's hands are shaking, and what do I think causes her confusion and combativeness? So some common side effects of Alzheimer's disease do include confusion and combativeness. These individuals can sometimes become combative if they feel a sort of physical discomfort. Like in the case of this patient, she fell, causing her to get serious scrapes on her face and on her arm, which can cause physical discomfort. And environmental factors also can lead to confusion and combativeness. In this patient's case, she may not recognize where she is at or who all the people in the room are with her. Therefore, she can become combative against them. Dementia with Lewy bodies is the second most common neurodegenerative dementia in the United States. And Lewy bodies are known to have common side effects such as tremors, which can be the result of the woman's hands severely shaking. Anxiety can also be a factor to her hand shakiness. And number 4, what assessments do I think are needed for this patient? So the first and initial assessment should definitely be a mental or cognitive assessment. Asking questions such as if she knows what her name is, if she knows where she is at, or if she knows what day it is, can help pinpoint the state of this patient's mental cognition, and sometimes can even help determine what stage of Alzheimer's she may be in. For the research question, it states that mental illness management includes both pharmacological and other therapeutic methods for treatment. Summarize how this is managed and support of insurance. Is it sufficient, and what could make it better? So pharmacological treatment is available through use of medications such as mood stabilizers like lithium, which is an antipsychotic drug which is used to treat bipolar disorders, or proxycycline, which is used to treat secondary Parkinsonism. Therapeutic treatment refers to the treatment that is managed through therapies such as psychiatry, help, or psychotherapy. In my opinion, support from the insurance is not sufficient. Poverty is found to be highly related to symptoms of mental illness, which makes it a bit more difficult for some individuals to access the help that they need due to the lack of finances. From my personal experience from working with insurances and behavioral health, I do know that many private insurances do not cover the cost of both pharmacological and therapeutic treatments. According to Tarnoff, this is because medical necessity is actually defined by insurance companies rather than by the needs of the patients or the referral from the clinicians. And companies' criteria for medical necessity often takes precedence over the actual treatment needs. The struggle with mental health and finding quality care could be better if all insurances could be a bit more lenient, such as the government based insurances of Medicare and Medicaid. If insurances would stop adding their own criteria as to what falls under the medical needs, then insurance coverage could become lenient and more available to all patients who actually need them. Thank you.